I'm Mario Preti, gynecologist-oncologist at the University of Torino, Italy, immediate past president on the International Society for the Study of Vulvovaginal Diseases. With our president Colleen Stockdale and the Executive Council of the Society, we have chosen as the topic of this year's Vulvar Awareness Day, vulvar lichen sclerosus. This dermatological disease is a chronic inflammatory dermatosis that affects women of all ages and is under-recognized and underreported. Although the etiology of lichen sclerosus is multifactorial, evidence suggests that lichen sclerosus is an autoimmune disorder with a genetical component and a local background. It is important to underline that lichen sclerosus is not an infection. It is not contagious. It cannot be passed onto a sexual partner. Careful history taken with itching, the most common symptom, and clinical examination are the mainstay of diagnosis. Diagnosis is mainly based on clinical features and it affects the genital, labial, perineal, and perianal areas. The skin becomes pale and white in appearance. This may be patchy or involve all the vulva extending down to the skin of the anus and causes secondary changes in open areas that cause problems with urination and burning. Scarring and loss of elasticity lead to dyspareunia. Vulvar lichen sclerosus does impact with the psychosexual health of women. Biopsy is seldom required and is reserved for cases where there is doubt in diagnosis or suspicion for preneoplastic or neoplastic diseases or resistance to adequate treatment. Even if the current International Society for the Study of Vulvar Disease includes lichen sclerosus with vulvar dermatosis, which are non-neoplastic and non-infectious in nature, the literature shows that the evidence that lichen sclerosus has a potential to transform into a vulvar intraepithelial or vulvar carcinoma. So this dermatological disease ideally linked to the ISSVD last year Vulvar Awareness Day. Vulvar cancer, yes. Vulvar lichen sclerosus has a not negligible from 2 to 7% risk of neoplastic transformation to squamous cell carcinoma. Longer duration of symptom and loss of vulvar architecture increase the risk of cancer, particularly in elderly women. Early detection of pre-invasive lesion as differentiated vulvar intraepithelial neoplasia is necessary to reduce the risk of cancer, which may be achieved by careful screening of these women. There is no total cure for lichen sclerosus, but symptoms can be controlled extremely well by use of strong corticosteroid ointments. Can be quite safe to be used in the genital. These can be used safely in genital area for this condition and reduce the risk for malignant transformation. What is our final message for Lichen Sclerosus Awareness Day? For patients, if you have symptoms in the vulvar region, refer them to your specialist, gynecologist or dermatologist. For specialists, consider treating and careful following patients with lichen sclerosus. For Lichen Sclerosus Patient Association, thank you. Thank you for what are doing and contact our Executive Director, Debbie Rope, for any initiative. Thank you for the Lichen Sclerosus Vulvar Awareness Day. Thank you.